Hello, my name is Mark Starr. I'm a medical doctor, and I'm going to tell you how to prevent heart attacks today. The answer to most of the questions you may have following my talk is when medical treatments do not make sense, the answer is always dollars and cents. So the cause of heart attacks and how to prevent them was firmly established by 1976. A book entitled Solved the Riddle of Heart Attacks was published at that time. The doctor was a famous MD, PhD. His PhD was in physiology of the thyroid gland from the University of Chicago in 1930. After 7 years of teaching and doing research on the thyroid, he became an MD in 1937 and spent the rest of his life doing research on animals and people, and he did a long-term study because he realized that most of the heart attacks that the rest of the country was having were completely avoided in his patients for whom he treated with hypothyroidism. So here's the book. It is no longer in print. It's called Solve the Riddle of Heart Attacks by Dr. Rhoda Barnes, MD, PhD. I was fortunate to obtain the 8th and final print in 1998. It is no longer in print, I'm sorry to say. And all the information in the book is not taught in any formal medical program, unfortunately. So I will go over the highlights with you. So he did a long-term study on heart attacks beginning in 1950. He also did 70,000 consecutive autopsy studies in Graz, Austria, where everybody who has died since the late 1700s has had an autopsy by state decree. And he has a research foundation in his name, Broda, B-R-O-D-A, Barnes, B-A-R-N-E-S.org, if you wish to delve further or make donations, because they do need money. They aren't supported by any formal corporation, for instance. So the connection between hypothyroidism and heart attacks. Hypothyroidism, one of the main problems that occurs is susceptibility to an increase in infections. Your immune system is very energy intensive, and low thyroid causes it to not work very well, and you get upper respiratory infections and lots of infections which are associated with heart attacks. The thyroid controls the body's metabolism, the speed and efficiency at which every cell in your body works. And when you become low thyroid or hypothyroid, the energy is not sufficient to maintain normal functions in the cells, and things start to go wrong after a period of time. So every animal ever studied, starting in the late 1800s, they took out their thyroid gland and they had accelerated hardening of the arteries. The illness was first described in 1875, and they started doing autopsies on the patients who died of hypothyroidism because the first cure was not until 1891. And they would give the thyroid glands back by 1891 after they were removed in all the animals, and the atherosclerosis, or hardening of the arteries, resolved. It stopped the progression of the atherosclerosis. And Broda Barnes knew this. He did research on bunny rabbits and lots of other animals, and he would place his patients on thyroid medication, and I'll show you his results. So the reference at the bottom of that slide is how to restore your immune function by using thyroid. This was his long-term study, which began in 1950. The National Heart Association started their own study called the Framingham Study in Massachusetts, Framingham, Massachusetts. They were trying to figure out why heart attacks had exploded after the Second World War. Before then, they were quite rare. And Dr. Barnes found out through his autopsy studies that it was because for thousands of years the hypothyroid patients died from the plague, smallpox, tuberculosis, and we introduced anti-tuberculin drugs in 1945 and antibiotics. And after 20 years, you can see, I'll use the pointer. So there were 1,569 patients in this study. The different age groups, just like they were in the Framingham study, are delineated here. The bottom line is in the normal population in Framingham, Massachusetts. After 1,569 patients were treated, they had to be in the study for at least 2 years, and some of them were in for the whole 20 years. Dr. Barnes should have had 72 heart attacks according to the Framingham study, and he did not. He had a total of 4 heart attacks in 20 years. So over 90% of predicted heart attacks from the Framingham study were eliminated. The patients were on desiccated thyroid. That was the standard of care for the first half of the 20th century. The dosages ranged from 2 grains to 5 grains. Grains are a measurement of gunpowder, and that's how they measured the thyroid back in the early 1900s, and it has stuck. We've changed it to milligrams now. Milligrams are about 65, 1 grain, and Dr. Barnes' patients were on 2 to 5 grains. So all 4 patients who had heart attacks were only taking 2 grains. And he theorized that he thought if he'd increased the dosage higher than 2 grains in those patients that he wouldn't have had any heart attacks. So in my 17 years of private practice, it has been my goal to have my hypothyroid patients on more than 2 grains of thyroid. And I'm happy to report that none of my patients who have been on more than 2 grains of thyroid have ever had a heart attack. So I'm certain Dr. Barnes was correct. I have to use synthetic thyroid in the patients with autoimmune thyroid disease. It is called T4 and T3, and the equivalent dosage is on the PowerPoint slide, and that seems to work just as well as the desiccated when you use enough of it. The new ebook is called How to Prevent Heart Attacks and Complications from Diabetes. Chapter 1 is How to Prevent Heart Attacks. Chapter 2, How to Prevent Congestive Heart Failure and Treat It. And Chapter 3 is How to Prevent Diabetes and how to treat it properly so you don't have complications. And Chapter 4 is all about treatment of hypothyroidism, which is the reason you can prevent heart attacks and complications from diabetes.